Hello, listeners, and welcome to Beyond the Mirror. This isn't just another podcast, it's a deep dive into the world of beauty, wellness, and longevity. Now, we're here to discuss what beauty really means beyond just appearances. We'll also talk about wellness, the habits and practices that keep us healthy, full of energy, and we'll explore the topic of longevity, looking at the science and realities of living a long, fulfilling life. So sit back, relax, and join us as we go beyond the mirror.
Welcome back to Beyond the Mirror. Today, we want to take a deep dive into an extremely sought after technology, and it has some very particular benefits and patient experiences that are very desired and permanent. And the future of these treatments, we're going to discuss that as well, that ultimately provide you, our listeners, with a very comprehensive understanding of this innovative technology that we call Agnes. So I have here today with me Jennifer Warmann-Bloss, and she does some very extensive research on all things aesthetics before we dive into anything at all. And especially when it comes to longevity, how the skin's going to look and feel, the long term, effects of all that stuff. So she is our expert today, and we're going to be talking about the Agnes, which is a a frequency machine, radio frequency machine.
Mm-hmm.
And can you explain how the Agnes technology works and its unique approach to fat melting and skin tightening?
Yes, absolutely. And I always like to say Agnes is the laser that no one knows about because
Yes.
I love the company that has created it. It's an amazing device. It is not well marketed and it's really fantastic. And the things that it's capable of doing, and it really is doing it for our clients. I'm just shocked that there's not more understanding of what it is and how it works. It is extremely unique. So there's tons of radio frequency, and we had another podcast actually about radio frequency and all the different versions of that technology. But this one, they figured out how to increase the output of energy with this precision. It's either a single tip needle or a tri tip needle to really do crazy things with the machine. And it's not all like visible cosmetic, but like sweating, for example. Like yes, you can of course see that, but it's crazy how this one device covers so many areas of repair. And basically the way it works is like RF microneedling, but we're using a precision, like I said, single or tri needle to either, let's say, if we're doing a mid facelift, we're tacking back loose skin like they would a facelift, or melting fat in an area that we do not want it. And it's just crazy, just the way it works.
It's
So there's
awesome. Yeah.
so there's a ton of areas. Why don't we go through some of the areas that it works well?
Yes. Yes. And also, who would be like an ideal candidate for, let's talk about first and foremost the under eyes, which I find so amazing that you can do this so quickly. So let's talk about that really quick. So, who
Yeah.
would be a good candidate for the under eyes?
Sure, absolutely. So, for everyone that hates their under eye bags, which a lot of times are a genetic problem, and there hasn't been a non surgical solution for that. I mean, people do filler there, but please go back and listen to the last one we did about filler. It's pretty risky. So, I would not do filler under the eyes. And some people just do it in that tear trough where the bag stops and where the cheek begins. And that could be worse, actually. So, the way Agnes works is we're using a single needle and we are putting it in, and it literally shrinks the fat pad that's causing that bag under the eye, and it's amazing. Generally speaking, it's a one-time treatment. Generally speaking, it's permanent fat removal in that area. And then we do go over it with tightening and the Vivace, which you've had a few times.
Yes, it's amazing. Tell me, is there any contraindications for someone who has under eye bags that Agnes wouldn't work for?
So sometimes that what you think is a bag is actually lymph. And so sometimes it's a pooling of lymph there instead of a fat pad. So if you come in and we're going to assess you for Agnes under eye bags, we're going to do this weird thing where we push on your upper eye and see if it pops out underneath. So you could do this at home. You stand in front of the mirror, close one eye, push on the actual eyeball, and see if that bag pops out underneath. Generally speaking, if it does, that's a fat pad. If it doesn't, it might be lymph. And then one other weird technique you can try is you can put preparation H under your eye before you go to bed. And if you wake up in the morning with no eye bag, it's probably lymph and not fat. So those are two funny ways, but you can then self-test to see if this is a treatment that would work for you. And yeah.
And then let's talk a little bit about the submental area, which would be like the chin. Tell me about that area.
So essentially, again, this has sort of three big areas of fat that are small areas of fat, three large, small areas of fat that it works well on. It works extremely well on under eye bags. It works extremely well on the chin fat. So, and again, we see this in people that have lost weight, but they can't lose that chin. That's just genetic fat. I mean, like you could do all the things perfect in the world and still have that pocket of fat. And so, again, what we're doing, that one's a tri needle, and we're using that tri needle across the whole area to essentially shrink and dissolve the fat. And then the body gets rid of it. And it takes months, just to be clear, to get a result from these. Generally speaking, 4 to 6 months to see a full result on those treatments. But the third area, well, actually, there's one more too. Like when people have a little jowl that hangs down just a little bit around the edges of the chin, like a little pocket, we can take that little pocket off. Or if someone has really heavy nasal labial folds, which was a joke that we were just having on one of our other podcasts, basically that folds by the nose. Some people are really heavy and weighty there. And if we just use Agnes to tweak that around the nose, magically they don't have that heavy lower face. And it makes a huge difference. But one of the funnest areas is bra fat, right? And so
Yes.
you've kind of seen this in action too. Like, what have you seen with us doing bra fat on the clients here?
So we just had a lovely woman come in and have her bra fat worked on recently, and the results looked immediate. And, it hasn't even fully set in yet. It's because it takes a few months to fully show, but immediately you could see the difference in how, like, 'cause it looks like it kinda hangs over the bra just a little bit. There was a definite smoothing of that, which was really nice to see
Yeah,
right off.
it's like really of all the areas we've treated, it's the one that has the most instant gratification.
Right?
You do see that really, really fast, and it goes away so easily. And what's cool with Agnes is you're getting skin tightening also. So you're not left with like a sagging skin pocket. Your fat is removed and now also your skin is tightened at the same time. So for an area like bra fat, that's phenomenal.
So what if somebody's coming in for just skin tightening? Is that something that you could do with Agnes?
So you can, and I've done, like, quite a few, like, just under eye tightening, for example, but in my opinion, the better choice might be a cool peel or a Vivace or a combination for those, because for the same price to do tightening, let's say, under the eye or around the mouth with Agnes, you could do an entire face with some of these other technologies, and I think they're equally as good for, like, basic skin tightening.
Yeah.
Now, the exception would be when we're talking about lifting. So, when we're doing a mid-face lift, you know how everybody, like, you're at home and you pull your face back or you pull your neck back, like in my big fat Greek wedding when they all, like, tug their neck back? We can do that with Agnes, where we're literally taking that skin, that loose skin, and pulling it back and tacking it next to the ear and the jawline. It depends on what area we're treating, and give them a mid facelift or a neck lift. So that type of skin tightening is different. So if you just feel crepey under your eyes or if you have smoker's lines, I would choose a different technology. But if you really need a lift, if you're like tugging at your face and your neck all the time, this is a great solution. It is so similar to the way they do a surgical lift. It's crazy. And yet it's all done just with a very passive energy with very little risk.
Tell me a little bit about, using Agnes for acne.
So originally, Agnes, and I believe the name has something to do with acne. The original clearance was for permanent acne reduction. It's amazing. So someone can come in with severe acne. It works best on the face, but it can be done on like the chest or back. It works like Accutane without the risk. So, like, what are some of the side effects of Accutane?
Oh gosh, it's really hard on the liver. It can cause birth defects. You know, they make you go through all these hoops and stuff to make sure that you're using 2 types of protection to make sure there's no pregnancy during the
Yeah, there's
use
a lot
of
of caveats, a lot of
Accutane.
GI. Some
Yeah.
people I know there was a bunch of lawsuits around that. Well, the beauty of Agnes is we're using RF energy to go into where the acne lives, and we're permanently shrinking the oil gland in the same way Accutane does without the side effect. So you don't have all the risk of a medication. You're just getting in there, you're shrinking that oil gland down. And literally in, 1 to 3 treatments, like, we've had clients in 2 treatments, they have almost no acne at all anymore. And we're talking dramatic, severe acne clients. I mean, this can really affect your outlook on yourself and how you feel, and even what products that you have to buy to maintain your skin, like, it changes everything about how you approach your skin. You're not just fighting against it all the time.
Yeah. Very cool. Tell me a little bit about how Agnes integrates. You touched on it a little bit, but how it integrates with other treatments that we offer at Elemental?
Well, and I wanna hit one more area other than acne,
Oh,
that's amazing is
the sweating?
sweat.
Let's talk about sweat then. Let's go there
Yeah.
first.
So, just like acne, actually, the laser shrinks the sweat gland. So, someone with severe sweating issues, we've treated both underarms and hands, and it really dramatically reduces the amount of, profuse sweating that happens. And, we believe in sweating. We're not against sweating, right? Like, you need sweat to detox your body. But if you're someone that is soaking your shirt all the time or your hands are profusely sweating and you're embarrassed to even shake a person's hand, this is the kind of treatment that could be very helpful to you.
Yeah.
And there's tons of technology that does this. However, a lot of them don't have much permanence to them, and they're very expensive and very you have to repeat them a lot of times. There's something called mirror dry. It's a laser, it's very intense, or you can do Botox in the sweating areas, but then you have to repeat it every 3 to 4 months, and so this is a great alternative because each time you treat and then, they recommend, between 2 and 4 treatments, you are each time you are reducing the volume of sweat.
Yeah, and we've had a few clients recently come in for that, and they've noticed a big difference almost immediately, right?
I mean, okay, well, we did my kid. My 18-year-old son, I mean, within 2 days, he had reduced sweating. It was
It
crazy.
was like the next day.
Yeah, and his only complaint was that his skin was really tight after.
That's
He's like,
funny.
"My skin's so tight, it's so weird," and I'm like, "Well, a lot of people would love that, but I can see you're 18, you don't need your skin tightened, really." But it is a side effect that does happen with that, so it's not a terrible thing, but it is weird. It is weird that you're doing sweat and you get some skin tightening from it as well.
That is funny.
So we'll go back to, though, your question about, marrying it. We always do Vivace. Well, there's a couple of times we don't. We don't do Vivace after sweating or acne, but any of the cosmetic services that we're doing with it, we follow it with Vivace microneedling. What we found is it really helps shrink pore size and soften things and tighten things up even better. But the most interesting thing is that the Vivace tends to remove any bruising that's caused in the process of doing an Agnes, which is really kind of the only downtime thing that happens with it. And so it's kind of crazy to come in with Vivace and just like how fast that bruising corrects on a person. Why don't you
So
talk
cool.
from like a nursing perspective about the numbing? So, talk about maybe comfort level and numbing and all that.
Yeah. So one of the things that I do love about Agnes is we are able to numb you really, really good. We use a nice lidocaine epi constitution with some bicarb, and that really makes it to where it's a very comfortable experience for the person receiving
It's
the radio frequency,
injected.
the procedure. Yeah.
Yeah.
And, and it's very, we don't go very deep. We're not, doing any kind of like blocks or anything like that. We're literally just very, not very deep into the surface of where we're actually going to be utilizing the radio frequency. And the nice thing about Agnes is you're not, the needle's not big at all. Like it's so small and it's just barely penetrating in. And so it's not like we have to, do really deep measures on the numbing. So it's a very comfortable, I always come in and ask, the clients like, how are you doing? And I don't feel a thing, and so it's really nice that they're not feeling it, and they're getting this really awesome look and experience and a very desired outcome in a very comfortable way.
And we do a topical numbing first so that even when you guys are sticking the injection numbing in, there's a reduction of the sensation of being of even being poked with that needle. Overall, most people find it extremely comfortable.
Yeah, and I mean, we've had the gamut of, different levels of what people tolerate as well. There's a lot of people that are afraid of needles and don't like the experience of needles, and they do absolutely fine with the numbing cream and the topical, and then also the subcutaneous numbing that we do. And it's a very enjoyable experience for them. It's not like it's not uncomfortable for them. It's not anything like, "Oh my goodness, I'm dreading it," or anything like that. It's totally a good experience.
Yeah, yeah, absolutely. And you're right, most people feel almost none of the actual treatment itself. We do, just to be real, we do get a random spot or so every once in a while. They're like, okay, I felt that one. But it's not like they're coming out of their skin. It's really not horrific in any way. And so it's a pretty easy treatment. And in regards to downtime, it's kind of a nothing burger. I mean, they can have some bruising from the nurse doing, the numbing. However, most people, because of the following with the Vivace after, they're like within a few days, the bruising is like hardly visible or gone. And really no one complains about the downtime. Like it's just never, it's not a big deal. Like you can wear makeup the next day. And there's not a lot of really amazing and dramatic services that you can do that with. I will dial back and say under the eyes, you can have some bruising, a little more bruising. And then at some juncture, when we're doing the fat removal on like the chin or the brow fat or under eyes, you get these weird little collagen balls. And because it is making collagen underneath the treatment area. So you get these funky little balls, and people have to massage them a little bit. And under the eyes, that can look a little weird on some people, and they do kind of hold on to them a little bit longer than others.
Interesting.
So, with the under eye, that's probably the area you have the highest risk of having a little fallout, but to have a permanent service that gets rid of your eye bag, I mean, that's
Yeah.
pretty amazing.
That is pretty amazing. Walk me through a little like a kind of mini scenario, start to finish. How do you assess if someone's the right fit? And then like from there, the consultation to post-care.
Sure. So it just kind of, when someone comes in and we're analyzing their face, there's a lot of me poking and prodding and pulling back and tugging and pushing on eyeballs and all kinds of crazy stuff
All
like,
things fun.
what do we have going on here? Will the skin move in the way that I want it to move? Is the fat pliable? Do I think it will go away? Is there an actual fat packet under the eye bag? So those things are kind of important when we're assessing you to decide, yes, are you a candidate? And the other thing that we need to think about too is we are going to pass RF through the body. So we also have some people we can't do, like no pacemakers, no heart, any kind of heart. I know you're better with these words than me.
Any heart condition really that would warrant
That has something
having
that's
that.
gonna jumpstart you or keep
Yeah,
you moving.
defibrillate or anything like that. Yeah, none of that.
None of that. So you can have a heart issue and have this done, and we've had,
Yeah.
yeah, but we don't want any hardware in there. So and so that's someone that should not do this, because the way that it works is we're putting energy through the needle and it actually comes out the body, or we ground the person in the body. So, generally speaking, the person comes in for a consultation. We make sure there's no medical reasons why they can't do this treatment. We do the treatment, in whatever time frame works for them. It does take quite a while. Like they're here for a long time, usually. There's a lot of topical numbing, injection numbing.
As I say, part of that's the numbing. You wanna be
Yeah.
nice and numb.
Yeah. And then the service itself is a precision service where we want to take our time, make sure we're getting it right. It's a very artistic service. So, like, when I'm working on a mid face or a neck, I'm like tugging and I'm sitting the client up and pulling, and is it moving still, and making sure the two sides are parallel, and like, so you want that artistic person to be working on you that can really view you and tweak how your face looks. And then we do pre-treat with a exosome, a very powerful exosome that does reduce the pain, the bruising, the side effect. You're not really even, you might be a little pink after, but not even really that. We treat you with an even more powerful exosome at the time of service that we send you home with more of, and then we have a repairing exosome that we use afterwards. All of this actually increase your collagen production by as much as 30% with your treatment.
So awesome.
But then it takes a long time to see your results. So it, I mean, on bra fat's the exception. That sucker just flies away. But the rest of it is like, I don't know, 12 weeks, 16 weeks, up to 6 months. I mean, I've definitely done an eye bag that I didn't think maybe had as good a result, and then all of a sudden at the 6-month mark, I was like, "Oh, okay." It just took them longer to recover. I mean, all bodies are different. It is a
Mhm.
healing process.
This is true. Are
And then
there any Oh, go ahead, sorry. Go
go
ahead.
ahead.
Oh, I was gonna have you, address, are there any, like, common misconceptions about radio frequency treatments like Agnes that you would like to address?
I mean, the big thing with RF is that people are paranoid about doing fat removal. So what I would say with Agnes is there are settings to do a facelift, a neck lift, and all that. And then there are completely different settings for fat removal. So will it do fat removal? It will, but it will only do it in the areas we are trying to do that with. So you're not going to suddenly get a skinny face from doing a mid facelift because we're not attacking that fat. We're not using as much energy. We're not like it's not as intense when we're doing tightening versus fat removal. So when people worry about that, this does it, but we are doing it differently depending on what we're trying to treat and what the outcome is.
I love
I
that,
love
and you said it, there's a
that.
very much so, like, an art to it, and I really do believe that your area of expertise and knowing how the skin plays out, how, the look and assessing really does play a key role in the results that somebody would get. You want the experienced person looking, you know?
Yeah.
And so definitely makes a big, big difference. Now, when it comes to Agnes, how does it contribute to some of the future of like non-invasive cosmetic treatments? And are there upcoming advancements that we can look forward to?
Well, I have just said for years that I just don't feel like we're that far away from, I'm sorry, plastic surgeons, but I do think at some point there's going to be amazing technology that people don't need to get diced up to get a result, and they can still look really, really natural. And I believe Agnes is kind of on the forefront of that, is like the start of that. We've done a lot of great work with another technology called plasma pen as well in the past. And like some of the things we can do with those two technologies are phenomenal, as far as non surgical repair, age reduction, super normal looking, long result. Like, so the fat is like a permanent removal, but when we do a neck and a facelift, it is years. You go years in between. I mean, you will age, your skin, like, the next day is already starting to age and soften. It's just the way that our bodies work, thanks to gravity. But
Gotta
it
love gravity.
but it's a long-lasting service. So, when you're doing an area like that, you're gonna get 2 to 3 to 4 years or more, depending on how you're aging, out of that result. So that's amazing.
That is
And it sounds like
amazing.
if someone has a really loose neck, we might do it more than once, but most of the time also we're just doing a single treatment.
Yeah, very cool. For someone who's considering Agnes, what advice would you give them?
I would say if you're not in our area, really ask a lot of questions of the technician or maybe try to look at reviews online and stuff. It is harder to find. Like I said, it is the super secret laser that unfortunately people don't know about, but has so much amazing potential out there. I do see it a lot in areas like Arizona and in the Mountain West. I mean, I've been out there where they like talking about Agnes, and people are like, "Oh yeah, no, I actually have heard of that." Not so much in the Midwest, but yeah, I mean, it's starting to get some recognition. I think it just won an award recently, even.
Oh,
Um,
very cool.
so yeah, it's got great potential.
I love that. That is wonderful. And any other things that you wanna add?
No, I mean, basically we wanted to talk about it because nobody knows about it, and we're here trying to educate you guys and keep you informed on the latest, coolest stuff that's out there. So we didn't want to miss out on this one topic that, again, is really new and fresh and has tremendous potential for so many people in so many areas.
I do have one last question for you. What is your favorite area to treat with Agnes?
Oh my gosh. I don't it's
You
it's
you
all
have one?
fantastic. I
It
I
is so
really
fantastic. I know,
am.
and I'm always amazed when I see, you know what I mean? Like, we get to see it all the time, and it just never gets old. It's always like, "Oh, look at what it did this time," you know? It's really cool.
Yeah.
Mhm.
I really can't say. I think doing under eye bags are the trickiest, which I like that you nurses are doing that. You already understand the structure of the eye better, and you just have better biological knowledge of that area because 'cause you're dealing with fillers and stuff like that, not around the eye, but the structure of the face and where things lie. And so I do prefer eye bags to be done by you guys because you just kinda have a different skill, but the rest of it, I'm like, "Yeah, just, like, bring me the sweat, bring me the acne, bring me the bra fat, bring." And we have lots of technicians in here that have done quite a few. There's a lot of talent in here that can do a great mid facelift or a neck lift or whatever. So, yeah, we have skilled people with lots of experience already on this device, and, you know, that's amazing. We're lucky.
So cool. Well, we appreciate you listening, and we hope to see you again on Beyond the Mirror.
We want to make a quick but important disclosure. The information and advice shared in this podcast are intended to provide general knowledge and understanding about wellness and health related subjects. They are not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider with any questions that you may have regarding a medical condition or treatment, and before undertaking a new health regimen. Remember, your health is your responsibility, and it's always best to consult with a healthcare professional.